Sue Moroney.
Thank you, Mr Speaker, and it is indeed an honour to rise and speak on this debate on the excellent report from the Health Select Committee into improving child health outcomes. I particularly want to congratulate Dr Paul Hutchinson for spearheading this very comprehensive approach and leading a multi-party approach to dealing with the issue that we should all be very concerned about in this country, in improving child health outcomes. I want to recognise and acknowledge all the members of the Select Committee. I wasn't on the Select Committee, but certainly through our Labour team of Annette King, Ian Lees-Galloway and Louisa Wall, was able to have input into this report through the very good consultation that they undertook with Labour colleagues on the issue. Mr Speaker, it will be no surprise to anyone in this debating chamber that the part of this report that I want to spend a few minutes talking about is in fact the part that talks about paid parental leave, because I do believe that this is an important factor for New Zealand children, and certainly the will of this Parliament and the will of the New Zealand public is that we make progress on extending paid parental leave. And I want to acknowledge and I think that this report probably has something to do with it. The approach that I had yesterday from the National Party to extend the report back date of my bill to extend paid parental leave to 6 months, to enable discussions to take place about how we might move forward on that issue, because I think that really is in the spirit in which this health report was brought together as well, that we can work in a multi-party way to make progress on issues that are of importance to children and their families. And so I welcome that. And I note that this report also looked into the issue of paid parental leave and didn't quite come out with a recommendation around extending paid parental leave to 6 or 12 months, but certainly did acknowledge that they had many submissions asking for exactly that. And I think that that's important, that is acknowledged in the report. And the recommendation of the report, in fact, is that it recommends to the government that it consider the possibility of providing more support for vulnerable women in the postnatal period to allow more opportunity for mothers to bond with their babies. And so I applaud the Select Committee for that, because I think that that was right and proper, that when in the section of this report called Social Economic Determinants of Health and Wellbeing, and I think that is the right place, exactly the right place to discuss paid parental leave, that they chose to focus on the parents who are most vulnerable, and correctly identified, and this is an issue close to my heart as well, that currently our paid parental leave laws miss out eligibility for some of the most vulnerable families. Those in seasonal and temporary employment are often the most vulnerable families, and our current paid parental leave laws do not extend coverage for paid parental leave to those families. And I certainly want to work with the government to make progress on that issue, alongside working with the government on making progress on extending paid parental leave to 6 months. I note that there was a submission from the Ministry of Health and advice from the Ministry of Health about breastfeeding and whether extending paid parental leave had anything at all to do with extending exclusive breastfeeding rates. And not surprised to see that the Ministry of Health doesn't see a link, because they've told another Select Committee I'm sitting on exactly the same thing. However, how does the Ministry of Health explain the figures that they haven't even bothered to gather themselves? They rely on the figures that have been gathered by Plunket, and Plunket, of course, is is an organisation with a very fine reputation, and I am very happy to rely on their data. The Ministry of Health does also. But the figures show that at 3 months exclusive breastfeeding, that really since the year 2000 we've been increasing by 1% a year, roughly, and then suddenly, in the year 2003, it leaps by 3.2%. So 3 times more the increase in breastfeeding rates in the year 2003.
What happened in 2003?
Ask ourselves, what happened just prior to 2003? The Labour government introduced paid parental leave at 12 weeks. That's what happened in 2002. Of course, the exclusive breastfeeding rate increased by 3 times the amount the following year. Isn't that evidence enough, I ask the Ministry of Health? But I will leave that for a debate on another day, because I do believe that what the Health Select Committee has done is absolutely moving in the right direction. I would be a little more challenging of the Ministry of Health on their assertion that breastfeeding rates is not affected by extending paid parental leave to 6 months. But again, Mr Speaker, reserve my right to discuss that at length on another occasion. Thank you.
Kevin Haig.
Thank you very much, Mr Speaker.